Picture this. A seemingly ordinary flu season turning into a nightmare for families, with more children facing severe illness or even death as flu vaccine uptake drops dramatically. It's a chilling reality that's unfolding right now, and it's one that demands our attention. But here's where it gets controversial. Is the decline in vaccinations really the root cause, or are there deeper issues at play? Let's dive in and explore the facts, stories, and expert insights that reveal why protecting our kids has never been more urgent. Christine Ware's voice cracks with emotion when she discusses the approaching flu season. The worry is intense, she shares. We're figuring out how to live normally without isolating ourselves completely. Her 4-year-old son, Beckett, is still on the mend from a flu infection he caught all the way back in January. Just days after falling ill, he became profoundly exhausted and immobile. He couldn't lift his head, move his arms, eat, or even speak. For Ware, a 40-year-old from River Forest, Illinois, this wasn't unfamiliar territory. It marked the second instance of Beckett developing a severe inflammatory brain condition triggered by the flu, known as acute necrotizing encephalopathy, or ANE. For a deeper look into this rare complication, check out this NBC News article on how it causes brain swelling in kids. https://www.nbcnews.com/healthnews/acute necrotizing encephalopathy flu complication kids brain swelling, RCNA 221838. This time around, his recovery to his usual lively self has been a slow process. His brain has needed more time to heal, Ware explains. The first diagnosis came in September 2022, when Beckett hadn't yet received his annual flu vaccine. By the second episode, he had been vaccinated, but experts note that the shots may not be as effective for those who've already experienced flu-induced brain inflammation. And this isn't just Beckett's story. Cases of pediatric ANE and similar flu-related brain issues are climbing. The latest data from the Centers for Disease Control and Prevention, CDC, shows that during the 2024-25 flu season, 109 children were diagnosed with this uncommon complication. You can review the full report here. https://www.cdc.gov. What's even more alarming? Of the kids with influenza-associated encephalopathy whose vaccination status hadn't been vaccinated. This statistic emerges amid a grim backdrop. The U.S. recorded 280 pediatric flu deaths last year, the highest toll outside of the 2009-10 H1N1 pandemic, coupled with a steady drop in childhood flu vaccination rates. For weekly flu surveillance updates, visit https://cdc.gov/fluview surveillance. Dr. Buddy Creech, a pediatric infectious disease specialist at Vanderbilt University Medical Center in Nashville, Tennessee, emphasizes the unpredictability of severe flu outcomes. We can't always foresee which children will suffer the worst effects, which is exactly why we urge vaccination for all, he says. It's a common misconception that only frail kids face complications from the flu. ANE itself is exceedingly rare, with only a few cases reported annually, and it hasn't been systematically monitored until now. Yet this season, healthcare providers have observed a noticeable increase in children battling severe brain inflammation post-flu. We lack precise numerical data to confirm a rise, but from my perspective as a doctor treating these patients, it felt like a definite uptick, notes Dr. Molly Wilson Murphy, a pediatric neurologist at Boston Children's Hospital and co-author of the new CDC study. And this is the part most people miss. The flu isn't just a cough and fever. It can unleash devastating complications on the nervous system. The 109 children in the study all had influenza-associated encephalopathy, or IAE, where the virus targets the brain and nerves. Symptoms vary widely, from disorientation and trouble walking to vivid hallucinations, uncontrollable movements, and seizures. Dr. Wilson Murphy believes there might be at least 7 distinct types of IAE. with ANE, the condition that afflicted Beckett, making up roughly 1/3 of the cases in the report. The outcomes are heartbreaking. Among these children, 74% required intensive care, 54% needed ventilators to breathe, 55% had been healthy beforehand, and tragically, 19% didn't survive. The flu poses a genuine threat to kids. Full stop, declares Dr. Keith Van Haren, another study co-author and pediatric neurologist at Stanford Medicine in Palo Alto, California. That's not an exaggeration. Now, let's talk about the flu vaccine. It's not perfect, but it's a crucial shield. Seasonal flu shots don't always prevent infection as reliably as stronger vaccines like the one for measles, mumps, and rubella, MMR. However, their true value shines in reducing the risk of serious complications and fatalities. As parents and healthcare professionals, our aim is to safeguard children's well-being and shield those at higher risk from worsening illness, Van Haren explains. Getting the flu vaccine is the most straightforward and effective strategy. Last season, the vaccine proved up to 78% effective in preventing hospitalized flu cases among children and teens. Dive into the details in the CDC report. https:/www.cdc.gov/mmwr/146a2.html. Shockingly, around 90% of the 280 kids who died from the flu hadn't been vaccinated. The optimal defense for you and your loved ones against influenza is universal vaccination, advises Dr. Sean O'Leary, an infectious diseases expert with the American Academy of Pediatrics. Early signs from the Southern Hemisphere's flu season offer hope. The vaccine has halved flu-related hospital admissions there. Yet, despite this, fewer children are rolling up their sleeves. CDC figures reveal that just 49.2% of kids received their flu shot last year, a decline from 62.4% during the 2019-20 season. O'Leary points out that the reasons behind this drop are multifaceted. Growing vaccine skepticism plays a role, but so do barriers like limited access to healthcare and staffing shortages in medical practices, which make it harder to offer convenient flu clinics on evenings or weekends. For more on vaccination trends, see this NBC News investigation. https://www.nbcnews.com/health news data investigation. Childhood vaccination rates are backsliding. U.S. RCNA 22887. The CDC recommends annual flu shots for nearly everyone age 6 months and up, with few exceptions. Check the guidelines here. https://hww.cdc.gov/season 2025 HTML. For vulnerable children like Beckett, widespread vaccination becomes even more vital. It's tempting to dismiss the concern if it hasn't touched your family, but getting vaccinated is a straightforward step to protect my son. But here's where it gets controversial. While experts unanimously advocate for the flu vaccine, some parents question its necessity, arguing that natural immunity or other preventive measures might suffice. Others debate whether the vaccine's imperfections justify the push for higher uptake, especially amid rising hesitancy. Is the focus on vaccines overshadowing other health strategies, like better hygiene or early treatment? And what about the rare cases where vaccinated kids still suffer severe outcomes? Does that undermine the message? These are tough questions that spark heated debates. Do you believe flu vaccines should be mandatory for school attendance, or is personal choice enough? Should we prioritize addressing access barriers over combating skepticism? Share your opinions in the comments. Let's discuss how we can better protect our children from this invisible threat. Erica Edwards is a dedicated health and medical news writer and reporter for NBC News and Today.